Welcome to Discovering True Health, where our goal is to provide you with cutting-edge health information through research, interviews with experts, and personal journeys to true health. Our message is a message of hope and healing, and our mission is to bring you on a journey to discovering true health, to not only find wellness, but to thrive. Hello and welcome to Discovering True Health, your weekly deep dive into health and wellness. Thank you so much for joining me today. Don't forget to hit the subscribe button to stay up to date on all our upcoming shows. You can also check out additional information on our website, Instagram, or Facebook. All those links are below. So today we'll be talking about healing trauma and PTSD, combining both Western science and Eastern philosophies. Studies show that unresolved childhood trauma can result in an increased chance for major health issues. So today we'll be learning some really great tools and therapies that help heal the root cause of trauma and PTSD and the related health and emotional issues. So my guest today is Dr. Vivianne Areola. She's a licensed psychologist with a degree in clinical psychology. She specializes in early childhood trauma, PTSD, mood disorders, addiction, chronic pain management, and she's worked with veterans for the last 5 years. She's also a certified hypnotherapist and is finishing her certification in past life regression therapy, where she'll be using it to focus on reconstructing trauma. Now, in her practice, she employs a holistic approach, focusing on understanding the root cause, and she integrates both Western science with Eastern philosophies, as well as alternative practices, including shadow work, positive psychology, hypnotherapy, sound baths, and meditation. And she has been a dear friend of mine for many years. So Vivianne, thank you so much for joining me today.
Thank you so much for having me. I'm absolutely delighted to be here with you.
So what I feel is so fascinating about your work is you're a doctor, a licensed psychologist, so you're well-versed in Western science, and you also incorporate a lot of alternative modalities and Eastern philosophies in your healing work. And we're going to get into some of those more in depth in a bit. So why integrate Eastern philosophies with Western science? How do they complement each other?
So being an avid believer of Western medicine and science, I have found personally and professionally that the combination of both really empowers an individual to set daily intentions and routines in the everyday life, right? So we're talking about, you can go to talk therapy or go to therapy, whatever style or modality that the therapist specializes in. But what do you do in between the sessions for those 6 or 7 days, right? So teaching my clients how to integrate Eastern philosophies, and there's many different forms, not only empowers them, but I feel like it really has helped them ground in the here and now because it's very experiential. You are really invoking all of your senses. So it roots you, it earths you. And in doing so, that's how we are able to experience more joy. Because truly, if you're not in the present moment, you tend to think about the past, there's depression, the future, there's anxiety. But when you're actively engaged with your body and your senses, in the present moment, you can achieve an overall level of functioning that's much happier in life.
Beautiful. Now this summer, you led the 2-day debriefing through the city of Miami for the Search and Rescue Task Force. And they were the first responders at the Surfside building collapse on Miami Beach, which was a horrible tragedy and many lives were lost. So can you talk us through what your role was and what your debriefing entailed, and how do you approach such a horrible tragedy and help those involved?
That's a really good question. So as you know, this past June, there was a 12-story beachfront condo in Surfside, Florida, and one of the towers partially collapsed in the middle of the night, which is absolutely terrifying and so heartbreaking. There were about 98 casualties. So 2 months later, FEMA search and rescue crew had designed a debriefing for the first responders that were there for all 29 days. So there are 28 teams nationally, and we had Task Force 1 and 2 down here in South Florida that were present at the collapse. So the city of Miami was working with FEMA, and they've been really amazing in following up with the first responders and their families, right? Because it affects everybody involved. So at this debriefing, they invited me to supervise and lead for 2 days. And what happened was they broke out into small focus groups. And I was there to kind of listen to their stories and be on call in case anybody would have any type of reaction, or just to kind of help anybody that needed some immediate therapy. And it was really mind-blowing to hear the passion, dedication, and seriousness that these men and women take in taking this oath of public service, and they put everything out on the line. I mean, these are men and women that were either former veterans, Vietnam, they were at 9/11, Katrina. I mean, they're incredible human beings. And just listening to what they took from that experience, you know, the negative and the positives, that to me was probably the pinnacle of my career so far, just being in a room filled with this caliber of individuals.
Heroes, they're super putting their lives on the line. Oh.
It was an honor. I did a brief presentation on PTSD, what that looks like, what that can manifest as, and how to cope with it. And I can get into that a little bit later in the show.
Yes, absolutely. So yeah, let's get into that. So let's start with childhood trauma and trauma in general. How does that affect our physical health and our nervous system?
Sure. So trauma can occur in 3 ways. You can either directly experience it, you can learn about it, you can hear about it, somebody that you know, or you can witness it. And what happens is when we perceive an experience or event to be either stressful or dangerous, our sympathetic nervous system kicks in. It's triggered into fight or flight mode. This is actually vital. We need this to happen, right? Like, let's say we're walking in a dark alley and I hear something. I need to get ready in case there's, you know, danger behind me. But what happens is, normally after you hit the sympathetic nervous system and it fires off into flight or flee to protect you, then it comes back down to the parasympathetic nervous system. And that's when we feel exhausted after, we can rest, we go back to homeostasis, and we find emotional regulation. But the issue here is when you are having traumatic experiences and they're happening frequently or for a prolonged amount of time, let's say somebody's being abused for years, that can really change the course or the trajectory of your mental health, because it begins to rewire you in a different way. So that's the basics of trauma. How it can manifest is, you know, there's a cluster of behaviors. We can either go through insomnia, nightmares, night terrors, flashbacks. Then there's the hypervigilance, looking over your shoulder, suspiciousness, hyperarousal. There's the guilt, the depression, the anxiety, the panic attacks, a disruption in memory, disruption in concentration. You can't concentrate for the life of you. And then, you know, addiction, of course, substance abuse, and your interpersonal relationships greatly suffer, because what happens is you start enclosing yourself and you completely isolate. So I have never worked with somebody who has PTSD, and I've worked with a lot of these veterans or, you know, lay people, and all across their board, their relationships are greatly suffering, their marriages are falling apart, or, you know, they isolate from their family members because people tend to put themselves on an island thinking they're either ashamed to say, hey, something's really wrong here, or they think that they can handle it on their own. And what you actually have to do is you really have to like raise your hand and ask for help.
Right. And this is something that can cause major health physical health issues further down the line, if not kind of dealt with. Now, what is PTSD? So is PTSD the effect of prolonged trauma, and what types of events and trauma can cause PTSD?
So that's post-traumatic stress disorder. It's the classification in the DSM-5. And that is what occurs after you experience a traumatic event. Either you experienced it, you witnessed it, or you heard about it, or even like, like natural disaster. But also there's neglect, there's sexual abuse, physical abuse, emotional or psychological abuse, and domestic violence. And out of all of those, the most damaging and detrimental is actually neglect in early childhood, above all.
Wow.
Mm-hmm.
Fascinating.
Mm-hmm.
All right. So now you use many different healing modalities in your practice. Let's start with shadow work. It's definitely the one that I know the least about. I've heard the term, but I don't know specifically what it is. So what is shadow work, and why is it important in the healing process of trauma and PTSD?
Okay, so shadow work. I love shadow work. It's deep. It's not for the weak, but to me, it's absolutely necessary and beautiful when you get to the other side. So Carl Jung was a big proponent of shadow work. So imagine, like those black and white cookies at the bakery, like chocolate and vanilla. Okay, right. So the white part, that's a part of our psyche. That's where we thrive, right? Like that's where, we're in our zone, we're confident, we're handling our business, we're doing really well. Then there's the black part of the cookie, which is our shadow. And that shadow follows you around literally like a shadow until you're able to enter that cave. The shadow operates at a very deep subconscious level. So it's not in your conscious mind, which we'll get into a little bit later. It's in the subconscious mind. And this is where all of our belief patterns are there, past conditioning, all of our triggers, pain, trauma. So the shadow basically is the area of our psyche, of our personality that holds all the traits that we don't really care to admit are there or we're not very proud of. Rage, addictions, anything that like is very intense. Something happens, you have a disproportionate reaction, something's being triggered, that's in your shadow. So when you go in there and you do the work and you figure out, first of all, what those elements are, every person has a different list of issues, right? And you're able to sit with yourself and confront it. I have clients that are sometimes so scared to even know what's in there. And others are like, let's do it. It's such a range of different motivation, but even those that are a little apprehensive, and I can understand I was like that at one point. Once you sit with yourself, you realize it's not as bad as we make it out to be. That's that, negative self-talk. But moving through it and sitting with those emotions and dealing with those issues that are unresolved is complete liberation and quite cathartic.
Wow. So how do you so the shadow part is in our subconscious, correct? Mm-hmm. Yeah. And then how do you is there a process to kind of drill down into to find those things? Is it kind of like just a self-reflection process?
Well, there's many, sure, that's a good question. I mean, there's many different ways you can get there through therapy that, specific therapy that tailors to that. Mm-hmm. There's plant medicines that support this. A lot of psychedelic studies are out there right now. There's ayahuasca. I mean, there's a whole range, right? It all depends like which level you want to go to, but you don't necessarily have to take plant medicine to do shadow work for those people that are not comfortable with that. You can definitely access it even through hypnosis. Mm-hmm. For passive aggression. You just have to find a practitioner that obviously is trained, and you want to know that your practitioner has also done the work, right? So that you're able to really connect with the person.
Absolutely. Now, meditation is another powerful tool you use as well. And you wrote an article recently that's currently trending about mindfulness and the importance of breath. So what are the benefits of meditation, and also what's the science behind it? How does it affect our bodies physiologically?
Okay, so if you think about the brain, The brain holds everything, right? You have your perceptions, our thoughts, our feelings, our memories, our images from the conscious mind. And when I say conscious mind, we use 10% of our brain. That's the conscious mind. The rest is subconscious and unconscious. So imagine that.
Hmm.
So we have all this in the brain. Simultaneously, you have all of the hormone levels, you have your heartbeat, you have your cortisol levels, you have the neurotransmitters, right? You have dopamine, serotonin, just to name a couple. There's many more. And then in addition to that, what happens is we have our biology, we have our relationships, we have our work environment, we have toxic experiences, substances. All this is wrapped into one interwoven process. So if you affect one thing, it affects the others. It's all influential, they're not separate. So we go about living our daily lives, and toxic experiences, people, environment, substance, whatever it is, something happens. When you're able to go back and sit with yourself and you focus on the breath is the most important function. Without the breath, our organs cannot function, right? We would not be here. So breathing, grounding, diaphragmatic breathing. When we focus on the breath, you can only focus on one thing at a time. It's scientifically proven. So if I'm sitting here with something that happened, if I just continue to reiterate or redirect my thoughts to my breath while breathing, that is going to instantaneously lower our cortisol levels. And what happens is through meditation, we're able to self-repair. Through that stillness and silence, we can go back to homeostasis. And there are actually neural images that show that after 8 weeks of meditation, the gray matter in our hippocampus increases. What is the hippocampus? This is the area in the brain that specializes in learning and memory. So when you meditate, there's scientific studies that prove it increases your compassion, your memory, your self-awareness, your focus, and your overall mood. So it's truly incredible to know that we can reverse the effects of these toxic environments and experiences if we implement a daily practice in our lives.
Oh, that's fascinating. So like really we're putting ourselves back in homeostasis. We're getting out of that fight or flight mechanism and really allowing our bodies to heal. And it's actually improving our brain activity.
Yeah, I mean, the number one, I will say the biggest complaint I hear for those working with me are my overthinkers. You know, why they're in therapy. You know, it's the compulsiveness, it's the fear, it's the anger, it's the worry, the overthinking. And meditation is fantastic for that because it causes you to pause and breathe, and you're better able to cope. It's really great for depression as well. But from what I'm seeing consistently are the overthinkers, that it's really working for them. And even I had a few clients that really didn't want to do this with me. I have more than half of my caseload meditating with me, and pre-pandemic and post-pandemic are very different. So during the pandemic, it was almost like a requirement because people were scared. I was scared. We were all scared. It was such a intense,
Fearful, yeah.
it was incredible to have to walk through this working with others, right? So we meditated, I meditate with them, and we went completely virtual. And I had, like, you know, elderly patients that were, well, I should say clients, actually, elderly clients that were really adamant about not wanting to do this. And finally they gave in. And now I have 2 of them who meditate on a daily basis, and it's completely changed their perception and their view. And it's incredible. I have kids meditating with me. I recommend apps. A few apps that are really great are Insight Timer. That's the one I use. There's Calm. There's Headspace. There's so many apps right now. Even if you just go on Google, there's so many different meditations. It could be fun. Start small. You don't have to pick a 20-minute meditation. Pick a 5-minute morning meditation, positive affirmations. You wake up with anxiety, find the folder that says anxiety, depression, you know, for sleep. I have a lot of people that are using the meditation apps to help them wind down and go to sleep. So it's been a really powerful tool.
And how are you seeing with your clients that have trauma and PTSD? How are you seeing the meditation help them?
Well, what happens is they're able to stop the rumination, the compulsiveness, right? Find emotional regulation, even if it's for those 5-10 minutes, because it guaranteed, if you just meditate, let's say 10 minutes, you're going to feel completely different than before you started. So panic is quite common, and I have suffered panic attacks. So when I help those that are really struggling to find a way to not have this control their lives, it can be extremely scary. So I really try to help them from not only a clinical standpoint, but also personally. I know what it is to have PTSD. It doesn't need to define you. You're not your diagnoses. It's a cluster of behaviors. It can be worked through and managed, but you have to be willing to plan your own exit strategy. It's not going to go away by you thinking that it will go away, because it won't, because it will follow you.
Right.
Yeah.
Take the steps and work with the tools. Now, you also are a certified hypnotherapist, and I myself have had really great results with hypnotherapy. It's an amazing tool to access subconscious and really make great shifts. So how does hypnotherapy work, and what led you to incorporating it into your work?
That's so great that you do it. I'm really proud of you.
Yeah, I've been doing it for so many years, like
Really?
tapes, and then I had a hypnotherapist do a personalized tape for me. So yeah.
That's great.
Yeah.
Oh, I'm proud of you. I actually just got into it recently. It's something that I've been wanting to do since literally I was a teenager. I've always been fascinated with it. So right after, let's say, right after things got, calmed down a little bit with pandemic, I'm like, all right, I need to, I try to learn something every year, one new thing every year. And I was able to train under Sheena Ismendi's. She's incredible. She's been doing this for over 20 years, and she certified me through IACT. It's the International Association for Counselors and Therapists, and it's recognized globally, which is really cool. So I can do this anywhere in the world. What happens with hypnotherapy, as you know, but for those that don't, is so what I mentioned before, there's like 10% of the conscious mind. That's ego, critical thinking, all of our executive faculties, judgment, need to control right here. Then under here is like the subconscious, the unconscious. So that's where we want to go. So in meditation and hypnotherapy, past life regression, things like that, you go into a state of focused attention. So you're able to go deeper. And when you go deeper, you're not controlling. And what happens when you're not controlling and relaxed? You're able to allow an induction. And that's what happens. We plant the seeds in there for whatever it is that you come to me for, that you need help with. And when you're in that state, the things that I will be saying to you will be much better received than if we're just having this conversation, because I'm going to be judging what you're saying and thinking, no, I don't, making my own opinions. But when you're relaxed in that state, then that's where we can access the beauty of whatever it is that you want to work on. So really, that's the scientific explanation for it. But once you're in there, you can work on your past trauma, addictions, compulsions, depression. There's such a wide range of areas that you can work on when you're in that deep state of meditation. People are like, oh, are you going to hypnotize me? It's not like that at all,
Time clock out.
You're completely in control the whole time, as you know.
Yep.
The person's just there to guide you, and you're just really relaxed so that you're able to take it in, and those effects stay with you.
Yeah, when I was in the middle of my battle with COVID last year, I was actually every day I would rest a lot because I couldn't move around much, but every day I would pop in my earphones, and I had a meditation for building white blood cells. And it was scientifically proven that this meditation, actually, they did a test group and the whole process to test it out. And it actually showed that the group that was listening to the meditation regularly was building more white blood cells. So I was going,
Really?
yeah, that was part of my healing process with COVID, with the tail end of COVID.
Oh,
Well,
I want to know a little bit more about that. I'll talk to you about that later on. That sounds amazing. I'm
yeah.
working with a long hauler right now, and
Oh,
it's been
I was
really,
going to ask what kind of results are you seeing with your patients or your clients and those with PTSD and trauma?
I mean, hands down across the board. Every single person that I'm working with just comes back to me. I always check on them 2 days later, and then a week later I'll see them. But even today, somebody I worked on for the first time, she just texted me right before a meeting saying, within 48 hours of our last session, everything you said when we were blah, 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 blah. And she was just going down the list. I've seen people really recover a sense of joy again from PTSD using it, depression, the overthinkers, the compulsions, they're able to refrain from their impulses, whether it's addictions or like arguing with their spouse. One woman that I work with, she went through this trauma and had not been able to cry in 3 years from it.
Oh,
She could not access emotional memories. She had memories, but she couldn't access the emotion, and it was stunting her ability to heal because she needed to sit with it and cry and feel it. So we were like, all right. She's like, I'm ready. I'm like, okay, let's do it. And this was all remote. Um, and sure enough, she hasn't stopped crying. But she's like, oh, that hypnosis
wow.
is a doozy. I'm like, I know, I'm sorry. She's like, no, I need it. And, it's part of her healing process, because
Mhm.
you can't feel and you can't sit with the loss, then you'll just kind of stay stuck.
It was probably the flood there. It was like a dam blocking up all the emotions there, and you just open the floodgates, and now she's getting the burst of emotions coming out.
Sure. I had this one woman recently come to me. She was out of her mind because she couldn't sleep. You know,
Oh,
she really needed sleep. She's a doctor, very successful. I saw her in person. I'm like, okay, come over. And we did it. And sure enough, she's like, I had the best sleep of my life. And she hadn't slept in like 10 days, and she was depressed from it because we know what happens to our mood when we don't sleep well. So that was truly amazing. It's, little things like that. I had a woman who's working with an IVF doctor, but we did a lot of hypnosis geared on the whole process, and she's successfully pregnant now. I'm not saying that it was the hypnosis. I
right.
firmly believe in the IVF, but I think it was a combination of doing the medicine and all that, what her doctor was prescribing with the hormones, but then also getting everything here in order to be able to create a healthy, loving environment for the baby to be conceived.
Oh, absolutely. Yeah, because it's
Mhm.
holistic. I mean, our thoughts, our emotions, that plays such a big role, bigger than probably most of us realize.
Mhm.
Now, another really great modality, and this is one of my favorites that you use, is sound healing, or sound baths is another term used for it. And I have used sound healing for many years, and I really love it. I used to go to my regular sound baths in Los Angeles at the Den, which
Nice.
I missed that since the pandemic. I haven't been to one. So what are sound baths for those that don't know, and how do they positively affect our bodies physiologically? We'll start with that first.
Great questions. Okay. So the ancient Greeks used to use music to cure mental disorders, which I find that to be so fascinating, right? And sound baths or sound healing can involve, sound bowls, crystal bowls, tuning forks, gongs, chimes, chanting, singing, anything like that. So if you think about it, our body consists of 70 to 75% water. The Earth's surface, over 70% water. So the science behind sound baths is the sound produces these overlapping deep vibrations that move the water through your body, which shifts and changes the compositions of the cells. And that is how we're able to release. It's like a pop from the toxicity. Again, we're going back to what I was saying before. That's how we release things. And it's incredible. I mean, it can really reduce anxiety, compulsions, overthinking, depression, panic. It increases sleep, mood, awareness. It revitalizes you. I mean, the list goes on and on and on. So that's the science behind this beautiful art form.
Beautiful. And what kind of or how does it affect us psychologically? What kind of psychological improvements are you seeing as well with those that you're working with sound healing?
Sure. So I actually incorporate it for those that I see in person, which are very few. I do mostly all virtual, but for those that I do see in person, I begin and end my hypnosis sessions with it.
Oh,
So it's
wow.
amazing. Yeah.
Powerful.
We set an intention. Well, they set the intention. Depending on what they want to work on, I use my crystals and I gear that towards the chakra that needs to be cleansed. I put that on them and then I play the sound bowl and and then after I do that, it kind of sets the mood. I start shifting the water and then we do the deep meditation into the hypnosis. And then when we finish and then I slowly bring them, back to the conscious mind, then I play it again at the end before we then talk about whatever experience they had. So it's incredible. Depression, anxiety, panic, all that. I mean, I have yet to hear somebody say that they didn't have a positive effect afterwards or their overall mood. And what I love about it, it's gradual. They instantly feel better. Sometimes they're like, oh, when can I come back? And I'm like, all right, let me check my schedule. But it's that moment. Yes, they feel great. But then it's the days that come after where they really start seeing the consistency in their overall level of functioning improving, which I guess the proof is in the pudding.
Yeah, because you're shifting them mentally and you're also shifting them physically and energetically,
Mm-hmm.
kind of all with this one or multiple tools that you're using.
Yeah, I mean, movement is medicine.
Hmm.
You have to move. You can't just sit there.
Yes, absolutely. No, we covered what trauma and PTSD are and some of the really great healing modalities that you're working with. So let's get into some action steps that we can all implement in our lives. So what are some great tools we can all implement, let's say during an actual panic attack or to help cope with a traumatic event that we may be in the actual moment?
Okay. So panic attacks, those are intense. You immediately, the breath. I know it sounds so simple, but like I mentioned before, nothing can function without the breath. So if you think about it, giving birth, elite sport competition, meditation, yoga, everything is around the breath and emotionally regulating. So start breathing. And it's not, no, I mean, proper breathing is you breathe in from your nose for, let's say, 4 seconds. You hold at the top for a couple of seconds and you exhale with your mouth for 6 seconds. So that's the longest part. You have to catch your breath. If you do this 5 times, 10 times in a row, slowly, it's a slow rhythm. It's like a dance. That's going to immediately help you feel calm, right? But what happens is during a panic attack, and they're so uncomfortable, we need to invoke your senses.
Hmm.
So if you can jump in a shower, if you're home, jump in a shower, water, get in the shower and wet your head. Name 5 things in the room. Listen, name 4 sounds that you hear, 3 things that you smell if you can. Try to drink something, eat something, but you want to invoke your senses again. Because why? Because it grounds you. And when you're grounded, it passes. Another thing is, if you've had a panic attack before this one, remind yourself you're going to live. You're going to get through it. It will feel like you're dying. Feels like you're having a heart attack or you're going to go crazy, but you're not. So tell yourself, I've been here before. I can get through this again. And what happens is when the panic attack comes and you're like, oh no, here it is. We're like, no, go away, right? Because it's uncomfortable. If you can somehow train your mind to say, okay, I'm going to release and I'm kind of like loosen up, as difficult as that may be, and like allow it to come in to pass you, because if what you resist persists. So if somehow you can just be like, okay, I know what this is, I'm going to let it pass through me. it won't feel as uncomfortable, right? But it's about breathing. It's about knowing you're going to survive it. It's about your senses. Remember, if you focus on the breath, your brain can only focus on one thing at a time. If you have an animal with you, that's really good too. Like hold your animal, rub your animal. I've been there. I've been there with my dog. Again, why? Tactile.
Mm-hmm.
You can't just sit or stand there. If you're sitting, get up, stretch your body. If you're standing, sit down, put your feet on the ground, hold something. Let's say you're in a chair, hold the chair because you need to touch something. So it's your senses. So that's for panic.
Wow, fascinating. So it sounds like all those different tools are really pulling you out of the emotional and mental and really putting you in the present moment, kind of.
Pulling out your mind.
Yeah, so you're kind of activating all your senses and now you're really present.
Exactly. You're completely engaged in that second of whatever you're doing.
Right. Yeah, that's probably. And I loved how you were talking about the self-talk, because I myself had experienced panic attacks after my COVID, pretty soon after I started healing, which I mean, you know me well, I'm pretty strong mentally and emotionally. And it was very shocking to me because I've never been out of control, my mind or, mentally or emotionally before. But that's one thing that really helped me, because I would start, trying to do a little exercise here and there, like maybe a couple squats as much as I could. And then when I would start having a panic attack, thinking my lungs would shut down, I would tell myself, well, you just did 3 squats like an hour ago and your lungs were just fine. So your lungs aren't shutting down. You can still breathe, they work. And that would start really kind of bringing me down out of it too. So yeah, that's a powerful tool.
That's fantastic. I'm so glad you feel better. Yeah, we tend to catastrophize. We start thinking from 0 to 100, the absolute worst thing that can happen.
Yes.
But what you did was CBT, really. It's like, do I have proof that this is actually going to happen? Yes or no? Okay. If yes, there's actually evidence that shows I'm going to die right now if I do 2 more squats. What's the evidence? Okay. And if there's evidence, then 2 or 3 quick action steps that you can do if something should happen. But if usually it's no evidence, it's just our mind, so then you need to replace it with another thought. But easier said than done. I mean, we intellectually get it, but when you're experiencing it, it feels like awful.
Yeah. The first couple times I had zero
Now are you doing like 50 squats?
Took me a minute. No, not yet, but we're getting there. Now, what about for those of us that are coping with some sort of childhood trauma or PTSD from trauma? What are some great action steps you recommend that could really help us get a handle on our mind and emotions and really find a path to healing?
Okay. So the first thing, ask for help. Usually we don't want to burden others. We feel like we're a burden. There's so much shame that's attached to the stigma of abuse. But there's got to be somebody. We're not meant to do this thing called life alone. We're here to help each other. But I get it. Sometimes, you encapsulate yourself when you're going through PTSD. You just want to, hide or deal with it alone. But that's not going to be very helpful. If we can get at least one person that we can talk to, and if you don't trust anyone or you don't want to involve a friend or family, find a professional. Whatever modality that works for you. It doesn't have to be therapy. There's so much out there right now. It's incredible. So we want to ask for help. Nature to me is as powerful as therapy. That's just my opinion. Just my opinion. But sunrises, sunsets. When's the last time that you looked at something that was happening that was just absolutely magnificent? Sunrises, sunsets, that grounds you. You see that there's something greater than ourselves, hopefully, while you're experiencing this. Hiking, being in the forest and the trees. That's very earthing. Gardening, using your hands, gloves or no gloves, in there, walking barefoot when you can in the sand or in soil, taking a walk. So If you think about the elements of the earth, there's air, fire, water, earth. And air, the element of air are the overthinkers, you know, it's all mental. So if you think about it, you go outside, fresh air. When you breathe in fresh air, it releases serotonin in the brain and it immediately lowers your cortisol levels, which is your stress hormone. So if you can go outside, if you have a balcony, go out your front door, get fresh air. Maybe all you have in you is to just stand outside and breathe. That's fine. If you can move, movement is medicine. Maybe all you have energy for is to walk to the end of the block and back or to the mailbox. That's fine. But do something, you know, just getting into the habit of moving. And then maybe a week from that day, you're able to walk a little bit more, then jog, yoga, exercise, a sport, whatever it is that you are sweating, because what happens is our neurotransmitters lie dormant in our brain. And the way we release it is through meditation, medication, or exercise. And I don't mean exercise where you're not sweating. I mean, you are getting it on and you're sweating, cardio or something that really pushes you. So that is what releases, you know, the happy chemicals in our brain. And usually when we're depressed or anxious, there's low serotonin, we need some dopamine. So it's your call. You either want to get on medication. There's no shame on getting medication. Sometimes it's very necessary for chemical imbalances, or you need to exercise, or you need to meditate. You need to do something, because if you just sit in it, you're just going to go further and further down the rabbit hole. And that's difficult to pull yourself out of that. Breathing, we talked about. Journaling, setting an intention, music, white flowers in your home, sage, you know, burning a beautiful candle that smells really, really good. Again, your senses, like these are all things that you can implement. But you need to try to find some joy in life again. And that's really difficult, especially when you're depressed or you're dealing with panic. But if you remove one negative behavior and replace it with something you've always wanted to do, never done, or maybe something you used to love and you just sort of gave up on it. But it's about kind of, that's the positive psychology, right? Like putting a positive behavior where there's once nothing or negative, but you don't have to do everything all at once. I'm just saying a bunch of different things, but knowing these things where you can take control of your health. You know, you don't become the diagnosis. Again, you're experiencing depression. You're not depressed. You're experiencing anxiety. You're not anxious. You know, you're going through PTSD. It doesn't mean that there's no hope. That's it. I have PTSD. You just really have to work at it like you would anything else in life, right? Like if I want to eat healthy, I have to go to the grocery store, buy healthy foods, cook, or whatever it is. I mean, we can't just expect to change if you're not actively trying to participate. But that's why sometimes you need to hire someone to kind of help push you. Trainer, a therapist, there's all sorts of, you know, a life coach, spiritual healer, whatever you want. But just to have somebody hold you accountable really helps, like the buddy system.
Absolutely, yes. Now, we can contact you through your website, which is vivasite.com, and I will post that below. And can you walk us through a bit what your process is if myself or anyone listening would like to work with you? And also, you're located in Florida, so would we need to be in your area? Or I think you mentioned a couple of times you do virtual sessions as well?
Yes. So my license is in Florida. So as far as therapy goes, I'm able to provide therapy for anybody in the state of Florida. I'm limited with the Department of Health. When it comes to anything other than that, let's say hypnosis, Reiki, anything like that, I can work globally, and we can absolutely do that virtually, which is extremely effective. I've been doing that mostly. And I've heard some like really positive effects on that. So if you go to my website, my emails are on there, my contact numbers on there. There's a few call to actions. There's many different areas where you can, you know, drop me a note, and I try to get back to everybody within 1 or 2 days.
So we can do teleappointments, you said, for Reiki, the hypnosis, does the sound baths, do those translate to, or they're more kind of in person?
I've done it. I would recommend if you want to do sound bath to find somebody locally.
Yeah.
For me, I think that that's just what I think is better. But I do play the sound bowls in my hypno sessions virtually. But yeah, I think that's a bit more intimate. I would recommend you doing that in person with someone.
Got it. And you also, I saw you have complimentary consultations, so you can kind of, meet and speak first and see if it's a good fit.
Yeah, we can do that even virtually, just so we can kind of see each other and, like you said, like decide if it's a good fit for both of us. And everything is there on my website. I also have an Instagram account. It's viva_psych. So it's vivapsych.com for the website, or viva_psych.com.
So I'll post that below as well then. Well, thank you, Vivianne, for joining us today and sharing all your wisdom. Do you have any final words for those who are dealing with PTSD or are living with past trauma that they're dealing with?
Sure. I think the number one thing here is the act of mindfulness. When you're dealing with this difficult emotion or thought, it's easy to become the thought, but we're not our thoughts. And it's easy, if you're not paying attention with awareness, you become that heavy emotion. So what I mean by that is you just feel really uncomfortable, let's say. Instead of saying, putting a negative label on it, just say, all right, I'm observing myself. And this is internally, you have to say it out loud. I'm watching myself right now, really having a difficult time. I'm really, really upset. I'm really sad. I'm going to sit here. And it's being able to sit with the emotion. I'm not going to freak out. I'm going to allow it in. I don't want to say welcome it in, because nobody wants to welcome it, but that's essentially what you should be doing. Like, just to sit there, observe the thought or observe the emotion and watch it pass through you, kind of like a conveyor belt. Because then what you're doing is you're creating a veil. You're creating this sense of detachment between you. Let's say you're crying and you're just so upset. Between you and the tears, you and that pain, and you're feeling it, but you're watching you're understanding what's happening, because there's someone in you watching this. As that's happening, the ability for it to pass is going to be far faster than if you succumb to it and you're just in it, where you don't even have the separation of, oh, this is what's happening. You have to kind of let your cerebral faculties kick in, because once your brain intercepts the emotions, you have some sort of a balance, because the brain is rational, the heart is not, right? So we need the brain to step in. And once you're cognitively having this conversation, there's a division. You don't become it, and it goes. Doesn't mean it won't come back, but every time, and sometimes will be easier than others, you're able to put that separation, which really helps you deal with it. But another thing, don't run from yourself. There's things you got to work through. Find somebody that's experienced and has the credentials and that you trust, and slowly sit with each issue one by one, because what's waiting for you on that other side is truly incredible. There are no words for that sense of freedom from yourself. We imprison ourselves. And asking for help, I can't say that enough. We need to raise our hands, ask for help. And if you feel that there's just no one that you really want to burden, because that's generally what I hear, there's always the National Suicide Prevention Hotline that's available 24/7 in English and Spanish, and that's 1-800-273-8255. So
We'll post that below as well. Thank you so much. That was so beautiful and so helpful. I'm sure many of them will be helped by this. If you like this video, please like and share it with others. This information could really help someone you may know. Also hit that subscribe button to be sure you don't miss out on our future shows. And remember, knowledge is power. The more you understand about your body, the better you're able to stay healthy and prevent disease. And a reminder, I'm not your doctor, so please don't take this as medical advice. If you have questions about your healthcare, feel free to reach out to your practitioner. and stay tuned for the next episode of Discovering True Health.